Welcome to today's lecture on the fascinating topic of temporomandibular joint, TMJ, disorders. In this comprehensive session, we will delve into various aspects related to the anatomy, function, pathology, and treatment of TMJ disorders. Our aim is to develop a deep understanding of the complex nature of these conditions and their impact on patients' well-being. The condyle is an important part of the temporomandibular joint, TMJ, that allows for jaw movement. Its smooth surface and interaction with the temporal bone are essential for normal function. Problems with the condyle can lead to TMJ disorders and symptoms like pain, restricted opening, and clicking. Inflammation plays a significant role in the development and progression of TMJ disorders. Various factors, such as trauma, microtrauma from parafunctional habits, or autoimmune reactions, can trigger an inflammatory response within the TMJ. The inflammatory process involves the release of pro-inflammatory molecules, including cytokines, chemokines, and enzymes, which contribute to tissue damage and pain. Understanding the underlying mechanisms of inflammation in TMJ disorders is essential for the development of targeted therapies, such as anti-inflammatory medications, corticosteroid injections, or biologic agents that modulate specific inflammatory pathways. The TMJ experiences significant dynamic loads during various activities, such as mastication or yawning. Understanding the biomechanics of the joint is crucial for assessing its load-bearing structures and identifying potential areas of vulnerability. The load-bearing structures of the TMJ include the fibrous articular disc, which serves as a shock absorber and facilitates proper joint mechanics, and the surrounding ligaments and muscles that provide stability and support. Disruptions in these structures can lead to abnormal load distribution, increased stress on the joint, and subsequent TMJ disorders. Emerging evidence suggests a genetic predisposition to certain TMJ disorders. Identifying specific genetic markers and understanding their role in disease development can revolutionize the field of personalized medicine and improve treatment outcomes. Genetic factors can influence the development of structural abnormalities, alterations in joint tissues, or the patient's susceptibility to inflammatory processes. By unraveling the genetic basis of TMJ disorders, clinicians can identify individuals at high risk, implement preventive measures, and devise targeted therapies tailored to specific genetic profiles. Summary: disc displacement in TMJ disorders impacts joint function and causes debilitating symptoms. It involves abnormal disc position or movement, trapping and leading to clicks, pops, or joint locking. Understanding its pathophysiology and natural history is crucial for diagnosis and treatment planning. Malocclusion refers to a misalignment of the upper and lower dental arches, affecting the way the teeth come together. This misalignment can exert excessive forces on the TMJ, leading to joint stress and the potential development of TMJ disorders. Understanding the biomechanical relationship between malocclusion and TMJ disorders is vital for both orthodontists and maxillofacial surgeons. Integrated orthodontic and orthognathic surgical approaches can correct malocclusion, thereby alleviating TMJ-related symptoms and improving overall oral health. Temporomandibular joint arthroscopy is a minimally invasive surgical procedure used to diagnose and treat various TMJ disorders. This technique allows direct visualization of the joint's internal structures, aiding in accurate diagnosis and targeted treatment. Indications for arthroscopy include severe joint pain, restricted mouth opening, or unsuccessful conservative management. The procedure involves inserting a slim arthroscope into the joint space, allowing visualization, irrigation, and potentially performing therapeutic interventions. Outcomes of arthroscopic procedures vary based on the specific TMJ disorder, patient characteristics, and the surgeon's expertise. Botulinum toxin injections are used to treat TMJ disorders by blocking muscle function, reducing pain, and improving joint function. However, careful patient selection, dosing, and consideration of long-term effects are important for optimal treatment outcomes. Relevant advancements in imaging techniques have transformed the evaluation of TMJ disorders by offering various options for clinicians to visualize anatomical structures, assess joint function, and plan treatment strategies. Comparative analysis of traditional and advanced methods is necessary for informed decision-making. In the video on TMJ disorder rehabilitation, we discuss the importance of rehabilitation in managing TMJ disorders. Various approaches, such as exercises and functional restoration programs, are used to improve joint function, reduce pain, and enhance quality of life. Physical therapy interventions focus on strengthening muscles, improving mobility, and promoting proper posture and joint alignment. Adjunctive modalities like ultrasound, electrical stimulation, or laser therapy may also be utilized. Functional restoration programs involve multidisciplinary strategies, including psychological interventions, dietary modifications, and stress management techniques, for optimal patient outcomes. In severe TMJ disorders, joint replacement surgery may be necessary. The surgery involves replacing damaged TMJ components with artificial implants. Rehabilitation is important for healing and restoring function. Assessing postoperative complications and long-term outcomes is crucial for treatment decisions. Psychological factors, such as stress, anxiety, and depression, can significantly impact the onset, progression, and management of TMJ disorders. A comprehensive understanding of the role of psychological factors in TMJ disorders is vital for providing holistic patient care. Psychological assessment tools, such as questionnaires and interviews, aid in identifying patients with significant psychosocial distress. Behavioral interventions, including cognitive behavioral therapy, relaxation techniques, and biofeedback, can help patients manage stress, modify maladaptive behaviors, and improve coping mechanisms. Collaborative care involving psychologists or psychiatrists alongside otolaryngologists facilitates optimal patient outcomes. In conclusion, TMJ disorders present complex challenges that necessitate a multidisciplinary approach for evaluation, diagnosis, and treatment. By exploring detailed aspects of anatomy, inflammation, biomechanics, genetics, and treatment options, we have gained a comprehensive understanding. We hope this knowledge will enable you to provide personalized care to TMJ disorder patients.